know, if there are any voice disruptions, if there is, it's difficult for you to see the screen, please let me know. All right. Okay. Right. So what we're going to do today is that we would be doing our grammar, right? We would be doing some tenses that are important for us to learn for the sake of OET writing, right? So we'd be doing some basic tenses, then we would be moving towards the passive and active, then countables and uncountables, right? Just simply going through almost everything, then some certain rules for capitalization and how you can use articles, then we'd be doing some formal and informal casual words, right? And you would be going through this, right? You'd be going through the whole file on your own. And then would be moving towards the abbreviations that one can use and capitalization and usage of comma, right? So we're not doing everything. We're just doing the things which are important for you to learn the basics of writing, right? So we're going to start with the tenses. Can anybody tell me the difference between a present perfect simple tense and a past simple tense or a simple past tense? What's the difference between present perfect simple tense and a past simple test? Right, the present perfect simple and the simple past tense. Any difference? Anybody has any idea? Because this is where I'll be asking you questions. Can you guys hear me? Dr. Najinda, can you hear me?
Yes, ma'am.
Okay, could you tell me what's the difference between the present perfect simple and the simple present tense, simple past tense?
Yes, ma'am. Ma'am, present perfect is when the work is done or in the
Yes.
continuity from the
In the
past. I mean,
and what's simple past tense?
I have been studying since 3 years.
Alright.
Simple present is, ma'am, to denote some truths, I guess. Like when we say this is, no, I
All
don't know
right,
how to explain that.
no, that's okay. I do understand. Yes, Dr. Nayab, are you there? Could you tell me what's a simple past tense?
Yes, I'm here. I think simple past tense means the work has already done and we use was or were. And present perfect, we use have or has.
Okay, all right. Yes, Dr. Zona, any difference between simple past tense and present perfect tense?
Yes, simple past tense tells about the work which has been completed, and present perfect talks about the events, like the work has been completed, I have been doing the work.
Okay, thank you so much for responding, everybody. So the main difference is that when I say past present perfect tense, right? When I say present perfect tense, what it is that, you know, something has present perfect tense means that something that started in the past, it continued till today and just ended right now. Or maybe it'll continue in the future, but it depends on what is the fact that it started in the past, right? So it started in the past and still continued till the day. That is your present perfect simple. Simple past tense means that it started in the past and ended in the past. It did not continue. Right? For example, I took a class yesterday. Done. I'm not still doing right now. I have been teaching OET for the past 12 months. That is something that I started in the past but still continuing. That's your past perfect tense, right? Now, there are three kinds of past perfect tenses. You have your past perfect simple, past perfect progressive, and past perfect passive. One thing that is really important for all of you to understand is that OET letters, around 80% of them are in the past tense, right? And in the passive voice, right? So the way where you say I or me or us or you, that's not what you'd be doing. You'd be saying it, she, they, or her, right? So it's in the passive voice and in the past tense, around 80% of them, right? So the tenses that would be using are the present perfect tense, right? The simple past tense, the past perfect, right? These are the things that would be doing. Okay. All right. Okay, so this is what is important, right? I have treated Mr. Smith at this hospital for 3 months, right? I have treated Mr. Smith at this hospital for 3 years, right? So this is something that the person started 3 years ago and still was continuing. However, maybe today he stopped. Then he says, I have been treating Mr. Smith at this hospital for 3 years. That means that this person had been treated from 3 years and still continuing to happen. Are you guys following? It's really important that you understand that present perfect tense means something that started in the past, continued till today. Present perfect progressive is something that has started in the past, continued till today, and maybe still going on. Understood? Everybody get through? Okay. Who is that? Who is that? I have no idea. Okay, I apologize for that. Can you guys hear me? Right. So see, you guys following what present perfect progressive is, first present perfect simple is? Because I'll be making you do exercises as we move forward. Dr. Dr. Nayab, Dr. Narjinder, do you guys follow? Are you guys understanding? Do you guys follow? Are you understanding this? Right. That is really, really important that you do this and understand this. So you would be using the words have and third form of verb, right? Or ing form of verb if it's progressive. If it's in the perfect, you'd be using the third form of verb, but you'd be saying I have been. Been is something that you'd be using a lot in your letters. So I have been, I had, or it has been, right? Depends on what kind of sentence it is, right? Do you guys follow? Right, that I have been treating Mr. Smith at this hospital for 3 years. I have been treating Mr. Smith at this hospital for 3 years. I have treated Mr. Smith at this hospital for 3 years. Mr. Smith has been treated at this hospital for 3 years, right? Depends on what is the context, right? So we'd be using this tense a lot where we'd be using a passive form of verb, right? For, since, and over, this is something that you'd also be using, right? So for means that, again, anybody tell me the difference between for and since? Yes, can anybody tell me the difference between for and since? Dr. Zona, what's the difference between for and since?
For is used for a period of time and since is used for a point of time.
Dr. Zona, could you please repeat what you said? The voice got cut off. Yes.
For is used for period of time and since
Mhm.
is used for a specific point of time, like it tells the start or the end point of time.
So you are saying that since is either at the start or the end, and for is for a specific
Like,
period of time, right? Yeah.
yes,
Okay. Yes, Dr. Narjinder, what is the difference between for and since?
Ma'am, for is used for, that's not specific. It's a specific, like for 2 years, for 3 years, for 4 years. And since is not specific in terms
Okay.
of time or year.
Okay. All right. Yes. Yes, Dr. Nayab. What is your definition for instance?
For is used for any period of time when we do not specify the time, and since is used when we specify the time period, like since that year, we mention the year.
Okay. Right. You guys are somewhat right. See, for is used when you know the starting of the time and the ending of the time. Right. So I'll say that I have been waiting here for 10 minutes. It means I started 10 minutes before and I ended right now, like 10 minutes after. So you know the starting and ending, that is your for, right? Describes a period of time when you know the beginning and end, right? So she has been sick for 10 days. You know the starting, you know the ending. That is your for and since. Right. So since is used for when you know the specific time, right? When you know the specific time, and that's just like the beginning of it, right? You just know the beginning of time. Right? So since it's for the beginning of time, like you just know the starting of it, and is for the and for is for the specified period of time, right? So okay, since it's for the beginning, right, from the start of time, for is for a specified period of time, over is used when you are trying to describe something that happened after a specified period of time, right? Or when you have seen something that repeated over a specified period of time. Are you guys following? I'm sorry for the distractions. I guess one of my candidates is asking something. I apologize for that. I hope you guys are focused. I'm saying you'd be saying for when you know the beginning of time and you know the ending of the period of time. Since is only used when you only know the starting of the period of time, right? She has been taking Parkinson's treatment since 2007, right? Over is used when you say that a change happened over this specified period of time, or a repeated condition or event has happened, right? So I say that Mr. Smith has his condition has deteriorated over the 3 days. That means that over some time his condition changed, right? So you describe a repeat or a change in a condition. That's when you use a time marker over. Are you guys following? Because I'll be making you do exercises. Do you guys understand when you use since, when you use for? One more thing is that when you'd be using for and since, you would be using have been with them, right? And you'd be using the word the, right? The and have been, right? She has been my patient for the past 3 years. For the past 3 years. I have been treating her since the year 2007. Since the year 2007, right? So you would be using those for, right? And have been and has been for since and for, right? You'd be using the past perfect tenses in here, and you would not be using any other tenses in here when it comes to for instance. Do you guys follow? Do you understand? Dr. Rajinder, Dr. Zona, Dr. Naya, is this clear?
Yes, ma'am.
I'll be making you do exercises now, right? So let's look at one, and you'd be solving this. This is for you, Dr. Zona. The patient was diagnosed hyperthyroidism 2007. The patient was diagnosed hypothyroidism 2007. How would you correct this sentence? Yes, Dr. Zona. Patient was diagnosed hypothyroidism 2007.
We have to use has with it. Has had diagnosed.
So you're saying that has had diagnosed
Yes.
since 2007? No, how would you correct the sentence? What would be the correct sentence here?
The patient has had diagnosed hypothyroidism since 2007.
Okay, the patient has been diagnosed with hypothyroidism since 2007.
Yes, we cannot use simple present tense with
So what would
since.
you be saying? What would you be saying?
The patient has been diagnosed of hypothyroidism.
Okay, the patient has been diagnosed with hypothyroidism since 2007. So you're saying the patient has been, right? Not was diagnosed, right? So that'll be correct. Let's see if it is correct over here. The patient has had hypothyroidism since 2007, not has been diagnosed, right? You can still say has been diagnosed as hypothyroid since 2007.
Can you repeat, like, why have they used?
Right. See, you'd be saying that the patient has had hypothyroidism since 2007. Right? Why? Because this is in the past perfect. Right?
Yes, okay, fine, I understand.
Do you understand? Do you understand?
Yes, I understand.
Okay. right? Also, you can say that the patient was diagnosed in 2007. So you're using simple past tense, but then you would not be using since with it, because I told you that when you're using the word since, either you'd be using past perfect as has had or has been, or you would be using the has been or has had, right? Do you understand, Dr. Zona? Is it Dr. Naya? Right? Okay. Yes. Okay. Dr. Narjanda, she has been problems with arthritis in her hands.
The time is not specified, so how do you use since in this?
Sorry, can you repeat that and speak a little louder?
The time is not specified in this statement. How we can use since in this?
Sorry?
She
No,
has
you're
been
saying that you cannot
problems with.
say, so you're saying that she has been problems with arthritis in her hands, and I say since 2002. How would you say this now? I think this
Okay.
is incomplete, but I'm saying since 2002.
Yes. She has been problems with arthritis in her hands
She has
since
been problem. She has been problem.
no. She has been.
Yes, she has been.
I could see the answer, but it's. I don't know why they are using having problems. I don't know.
Okay.
She's,
So what would you do? How would you correct it?
uh, I guess she has had problems with arthritis in her hands is good if the time is not specified.
Okay, so the time is not kept
Yeah, she
specified, right? So you'd be saying
then
she has
she
had
has
or
had
she's having.
she has
She
had
had.
problems
She has had problems with arthritis in
with
her hand.
arthritis in her hands. Yes,
Okay, she
if
has been
time is
having,
not mentioned.
right? So I said 2007, right? So, okay, she has been having problems with arthritis in her hands since 2007, right?
Yeah,
Or
then
she
that's
has
correct.
had problems with arthritis in her hands since 2007. You're saying the right thing, right? All right, Dr. Narjinder, is that clear?
Yes, ma'am. Ma'am, is that correct? She has had problems with arthritis in her hands.
Okay, so you're saying that she has been having problems with
No,
arthritis in her hands since
I'm
2007.
saying she has had problems with arthritis in her hands. That's all.
That's also right, right? That you could use either simple present perfect or present perfect progressive. Do you guys follow? Should we move to the next one? Right, just last one for Dr. Nayab. Dr. Nayab, did you get a chance to do it? All right. Over the past week, she remains free from severe pain and has been able to tolerate a fluid diet. How would you correct it? Over the past week, she remains free from severe pain and has been able to tolerate a fluid diet. Is this correct or incorrect?
She has remained free.
She has?
I think so. She has.
She has remained, right? She has remained. Okay, let's see if
Yes.
this is correct. She has, I'm just going to take this down. So she has remained free from, right? Because it's your present perfect simple, right? So you guys are following. That is great. Let's move to the next thing. The next thing here is your simple past, which is present perfect or simple past tense. How would you differentiate between the two? Are you guys following? Do you have any questions so far? You guys have not changed your names, so it is impossible for me to know who is what. If you guys have any questions, please do ask. Right? Okay. Do you guys follow how would be using the simple past tense and sorry, the present perfect tense, both present perfect progressive and present perfect simple? Understood? Everybody get it? Right? Okay. Now let's come to simple past tense. Now, simple past tense and present perfect tense, there is often a confusion, as they say. What you have to know is that when you're referring to a period that starts in the past and ends there, that's your simple past tense, right? As we talked about. Present perfect is something that starts in the past and maybe continues till today. That's your present perfect tense, right? So, for example, he sucked his hen until he was 5. So it happened there. He has been sucking his thumb for 5 years. That means sucking, it means it's still going on. Seeing is still going on. He has had diverticulitis for the last 12 years. It means still going on. Right? You guys follow? Understandable? Right? Anybody has any questions for your simple past tense and present perfect tense? Dr. Naya,
Can you
Dr. Sona?
can you repeat
Yes.
it?
Ma'am,
Yes.
isn't it present perfect continuous tense?
Which one?
He has been sucking his thumb for 5 years. Present
What we're,
perfect continuous.
yes. What we're trying to differentiate is the difference between simple past tense and present perfect tense. See, in simple past tense, a thing would start in a particular period of time, it'll end there. In your present perfect tense, whether it is a present perfect simple or a present perfect progressive, a thing might start in the past, continue till today, and maybe end today, or maybe continue forward as well. But it started in the past, right? Is that clear?
Fine.
Dr. Naya,
Yes.
Dr. Sona, Dr. Narjinder, please change your names so that I can see who is what. Live CID and guest 854248330. Do you guys follow? I mean, you guys have weird names, but hopefully you guys are following, right? Okay, now let's come to active and passive verb. Now, this is really, really important for your letters, right? So what would happen is that on your exam day, right, you would be having active and passive. And I told you that, you know, you would be having your test. And what would happen is a lot of candidates would start by saying, I'm writing to refer, which is fine. But later on, they'll be saying that Mr. John has been coming to my clinic for hypertension. I have been treating him with beta blocker, right? So what we're saying here is that Mr. John has been coming to my clinic and I have been treating him with the beta blocker. If you guys are not following, please do ask me. I'll repeat the thing. All right. And if I'm going fast, do ask me again. This is a crash course. This is why it's in fast forward play motion, right? So what I'm saying is the difference between active and passive is that, you know, when I'm saying that Mr. John has been coming to my clinic for the treatment for hypertension, and I have been treating him with beta blockers. So what I did was I said my clinic, I have been treating him, right? He is my patient, so I focus on me. Now the next sentence, do listen to it and find out the difference. Mr. John has been treated for hypertension, for which he has been prescribed with beta blockers. I do not talk about me. Right? I do not talk about me. I talk about Mr. John, and I focus on his treatment more as compared to what is what I do or when he came to my clinic. Right? Do you guys follow? So when you are going to use your passive form of verb, you're focusing more on the patient. Do you guys follow? See, I advised the patient to stop smoking. The patient was advised to stop smoking. We focus more on the patient. Do you see the change in the words, right? I advised. Your advice comes first. The patient comes later. Here, the patient comes first, advice comes later, right? So if you guys know, there is a very common saying when you go to restaurants, etc. They say that, or when you are dealing with a customer, they say that customer is always right, or you always put the customer first, right? So we as doctors, our customers are our patients, right? So we have to put them first, their treatment first, their management first, their investigations first, right? So when in a sentence you are using words, make sure the words are more focused on the patient, right? For example, in a sentence you're saying, Mr. John was treated for hypertension. I prescribed, right? Just see it's prescribed beta blockers, right? Now, what I did was I said, Mr. John was treated for hypertension. I prescribed beta blockers. What if I said like this? Mr. John has hypertension for which beta blockers were prescribed. So my prescription things comes last, or I could say beta blockers were prescribed to Mr. John for hypertension. So in a sentence, when you have to focus on you, like in a sentence, you have you, I, your clinic, your department. Then you have the diagnosis of the patient. Then you have the lab of the patient. Then you have the treatment of the patient. Then you have the management of patient. What would you do? You would focus the second thing first. Let me just clear this out. So I say, I diagnosed Mr. John with hypertension. This is my active form of verb. This is what we're talking about. I diagnosed Mr. John with hypertension. Now this is active. I want to turn it into passive. I'll be putting diagnosis first. I'll be saying hypertension was diagnosed in Mr. John. Right? Now in a sentence, I have your diagnosis and lab reports. I'll be saying that John underwent an MRI. Right? Mr. John underwent an MRI. An MRI was conducted on Mr. John. I focus more on Mr. John. It makes MRI first, so it makes my sentence more passive. You focus more on the investigation. Do you guys follow? Dr. Zona, Dr. Nayab, Dr. Narjinder, Dr. Life, CID, and guest. Do you guys follow?
I'm sorry to interrupt, but your screen is not visible to me.
My screen is not visible? You should have
No.
interrupted me earlier. It is really important that you interrupt. Can you guys see it?
Still not. I can hear you, but screen is not visible.
Is it the same with Dr. Zona, Dr. Najinder as well? Have you
No, ma'am,
rejoined,
it's
Dr.
visible
Naya?
on my side.
Yes, I
Dr.
rejoined.
Dr. Najinder, can you see the screen?
Yes, ma'am, it's visible.
Okay, you can see the screen. So I'm just going to stop it and do it again. Can you see the screen now, Dr. Naya? Dr. Naya, can you see the screen now?
Still not.
I'm recording it. Don't worry. Just hear me out. I'll be posting it on Facebook group and YouTube. Kindly rejoin, right? Or maybe reinstall WhatsApp. Don't worry. I'm still here. I'll be repeating it for you, or I'll just send you the recording, right? But just like reinstall your Skype, or like reinstall your net, or like just reconnect.
All right.
Okay, Dr. Najinder, Dr. Zona, Dr. Nayab, I'm hoping you can still understand, right, Dr. Nayab? You still following?
Yes.
Right. So what I'm trying to say is that in a sentence, when you're writing a sentence structures, you would be given in a sentence, for example, your first priority is that you are having two things in your sentence. You're talking about the diagnosis and the treatment, because treatment is something that you do later. You put the treatment first in your sentence, right? For example, the patient has been diagnosed with hypertension, for which he's taking beta blockers. Beta blockers have been prescribed for hypertension. Right? The second one is more focused on the treatment. That is your passive form of verb. When you use the passive form of verb, Dr. Naya, this is on third page of the grammar file that I've sent you. Active and passive, kindly look at that, open that up, right? So that you can see, right? So what I'm trying to say in here is that focus on the patient, their treatment, their diagnosis, their management by making your letters in passive form of verb. Yes, you can use active form of verb, but just in the beginning when you say I'm writing to refer, or when you end, thank you for seeing, or I'd be grateful. Do you guys follow? Understandable to everybody? Dr. Zona, Dr. Naya, Dr. Narjinder? Clear?
Yes, I understand.
Clear.
Clear,
Yes.
Dr. Narjinder? No questions? Right. Now let's make you do some exercise. Dr. Naya, please open your grammar file, and we are on page 5 now. Okay. Yes, Dr. Narjinder, this one's for you.
Okay.
She was performed a colostomy accompanied with a partial bowel resection. Is it a correct sentence, Dr. Narjinder? She was prescribed a colostomy. She was performed a colostomy.
Screen is not visible.
Right. So she was prescribed with she was performed a colostomy accompanied with a partial bowel resection. Dr. Narjinder, how would you correct this? She was performed a colostomy accompanied with a partial bowel resection.
One second. Colostomy was performed on her, accompanied with a partial vowel resection.
You're saying the right thing, right? Colostomy was performed, right? Accompanied with a partial ball resection, or instead of doing this, you could say she underwent, right? You could say she underwent a partial ball a colostomy is performed with partial ball resection, or she underwent a colostomy along with partial ball resection, right? So you're concising it and making it clear. All right, this one's for you, Dr. Zona. Hopefully you can hear and see this screen. As per the doctor's orders, we organized daily home visits. We were organized daily home visits. Make it
As per
more
the doctor's order, daily home visits were organized.
right. We remove the we because we're trying to make it passive, right? Yes, Dr.
Passive.
Naya, I hope you can see the screen. The next one's for you. On subsequent visit, the treatment options was discussed. It's on page 5 of the grammar file. In correction number 4. On the subsequent visit, the treatment options was discussed.
The treatment options were discussed on the subsequent visit.
Right? So just trying to make sure that you guys are following it. It's very easy for you. Hopefully you would be doing it. Now let's come to your past perfect tense, right? Okay, so in your past perfect tense, what happens is that you would be talking about things that happened very before and you cannot change them, right? And this tense is very important for referral letters as it would help you in distinguishing the order of things, right? It would help you in distinguishing the order of things, right? So in your past perfect tense, what happens is that, for example, I'm saying there's a patient, they have infertility, right? They have infertility, and there's a patient, they have infertility. I hope you guys are listening. So I say, Mrs. Lisa, Mrs. Lisa, let me just say that, Mrs. Lisa has depression, full stop. She has insomnia, or I'm saying that she has been insomniac. She has been insomniac, right? She has lost appetite, right? And lost weight, right? So what I'm saying here is that there is this patient named Miss Lisa. She has depression. She has been insomniac. She has lost weight and lost appetite. Can any of you tell me what happened first? Dr. Zona, can you tell me what happened first? Yes, Dr. Zona. Can you distinguish in this what happened first? Like Mr. Lisa has, she's infertile, she has lost weight, she's depressive, she's insomniac, she's lost appetite, she has lost
Appetite.
weight. You're just guessing, right? So like you, when you write a letter and you write like this, then the examiner is only guessing what happened first. Now now see how I write it, right? Now the next time I say that Mrs. Lisa has is having infertility, because of which she has had insomnia and has had lost appetite. Along with that, she has lost weight, right? So what I do here is I'm using has had not been, has had, just trying to make, sorry, I'm using had been, right? What I'm trying to do here is I'm trying to make it in the past perfect so that I can see what happened first and what happened next, right? So see over here, right? She had not been able to conceive, That's the first thing. Over the previous 4 months, and as a result, she was suffering from depression, right? I could have said that she has not been able to conceive and she has depression. Now, I don't know what happened first, whether she was having depression first, whether she was not able to conceive first. What was the trigger for infection, for her depression? So when I use past perfect, what I do is I tell the examiner that, you know, this thing happened first by using past perfect tense. I say she had not been able to conceive over the previous 4 months, and I use as a result to tell them that this is why she was suffering from this depression. Let's recap. What I'm saying here is that when you combine the past perfect tense with the simple past tense, you can tell them what happened first, right? For example, another example, there's a patient, they are obese and they have developed depression, right? I'm saying Miss Lisa is obese and she has depression, right? Both are in what? In past tense. Miss Lisa has obesity and she has depression, right? Both are what? In either present tense or past tense. Or let's just make it past tense by saying that Miss Lisa was insomniac and she was depressive. Past tense. Both is in past tense. I don't know what happened first. What if I said that Miss Lisa had developed depression and as a result she had been insomniac or something like that? What I'm saying here is that when you use past perfect tense with simple past tense, you tell them that what happened first. Do you guys follow? One more thing is that you cannot use the past perfect tense on its own, right? For example, I'd not be saying that she had been feeling unwell. I would not be saying she has had depression, full stop. No, I'll be saying she has depression. If you're using your past perfect tense, you have to use something of simple past tense with as you move forward. Dr. Narjinder, Dr. Zona, do you guys follow? Dr. Nayab, do you guys follow? Is it difficult? If it is, I'll be clarifying more. I'll be making sure you understand. Is it still difficult? Because we'd make sure you understand.
Can you give one more example?
Yes, over here. Now you see, I'm just going to look at this. I hope you can see the screen. I'm just going to go through this one, right? So I'm saying, let's just read this one, right? So this one says, when used with simple past tense, it allows the writer to distinguish between the order of the events, right? So here, the patient had been feeling unwell last week, right? The patient was feeling unwell. This is your simple past tense. This is your past perfect tense. Now, this is a correct sentence. But when I use a simple, this past perfect tense without a simple test, it is a grammatic rule that when you use past perfect tense alone, it doesn't make much sense because we use past perfect tense to make sure we're comparing something with something, right? So what you'd say is, let's see, when I say past perfect, by that I mean something that happened in the past, it's done, it's over, it cannot happen again. Right? For example, there's a patient, she comes up to me and she has lost weight, right? I'll be saying, today, Mr. John presented with decreased appetite and weight loss. This is okay. What if I said, today, Mr. John had presented with decreased appetite and he had lost weight. He had lost weight. So that means it happened before he came to you. Right? So you use past perfect tense when you're trying to say something happened before you wrote the letter, before something else happened as well. Do you guys follow? I'll be making you do these sentences. Hopefully then you'd be able to understand more. See, the thing here is that you cannot use past perfect tense on its own. You would be using past perfect tense when you're using simple tense with it, simple past with it, right? I cannot just say that she had been losing weight or she had been unwell on its own. I'll be saying she had been feeling unwell because she was admitted to the hospital, right? I cannot use past perfect tense in the same sentence twice, right? I cannot say that she had been feeling unwell, she had been losing weight, she had been losing appetite. I can do that, but I cannot just keep on doing it unless I don't write a simple past tense with it as well, because we're trying to compare things. Do you guys follow? It's really important you understand this because half of your letter is going to be like this. Dr. Narjinder, Dr. Zona, Dr. Nayab, are you guys following?
Yes, ma'am.
Clear?
Yes.
Yes.
All right, let's make you do some sentences. Okay. Can you say your name, Dr. Larry CID? I don't know what your name is so that I could just, know what your name is and I could call you by one. Yeah. Okay. All right, so this one said she presented to me, this is for you, Dr. Narjinder. She presented to me on this date for a regular checkup because she experienced several episodes of heart flutter over the past few weeks. She presented to me on this date for a regular checkup because she experienced several episodes of heart flutter over the past few weeks. What is incorrect here? It's a seemingly fine sentence, but there is something incorrect.
She presented to me on for a regular checkup because she had experienced several
Yes,
episodes of
she
heart
had
flutter over the past.
right?
Yes, ma'am.
Yes,
Yes, she
right?
has.
She had experience because this is something that happened very ago, right? She had experienced several episodes of heart flutter over the previous few weeks. Now, one more thing is that when you're writing your letters, you cannot say past, you'd be saying previous. Is that clear? No past, but previous. Okay, clear, everybody? Right? Okay, Dr. Zona, this next one's for you. This one says, she presented to me yesterday evening with abdominal pain, mostly on the left iliac fossa, and was since 24 hours. She presented to me yesterday evening with abdominal pain, mostly on the left iliac fossa, and was since 24 hours.
She presented to me yesterday evening with abdominal pain, mostly on the left iliac fossa, which was occurring.
Okay, you see, there are three things happening here. She presented to you yesterday evening with
Yes,
abdominal pain, mostly on the left iliac fossa, and that was there for 24 hours.
yes.
Okay, so what would you do here? Like, how would you correct it?
Because there is a comparison from the yesterday evening, so we'll use had been.
Yes, Dr. Zona, be very, very honest. Are you following so far? Because if you're not, then I'll take another day for grammar too,
Yes, I am following.
right? Then it's okay. That's okay. That's okay. All right. So you're saying that she presented to me yesterday evening with abdominal pain, mostly on the left iliac fossa, and that had been there for 24 hours, right?
Yes,
Now you see here, we've used the word since. With since, you cannot use simple past tense as was. You'd be saying that had been there for 24 hours, right?
yes,
Okay. With since or for, you cannot use simple past tense. Rather, you'd be using your had been, right? So over here, you see that had been occurring for the previous 24 hours. You would not say past, you would say previous, and you would not be using with for or since, was or were. You'd be using had been or has been or has had, right? You'd be using your past perfect. Do you follow, Dr. Zona?
yes, yes, I follow.
Are you sure? Because I'm going to make you do another one. If you don't, you have to ask. All right?
I have
Okay.
one question, ma'am.
Yes. Yes, please.
Ma'am, what if we use simply since 24 hours, on left iliac fossa since 24 hours?
So you're saying that she presented to me yesterday evening with abdominal pain, mostly on the left iliac fossa, since 24 hours. It's an
No,
incomplete
ma'am.
sentence.
No. Yes, ma'am. Yes.
It's an incomplete sentence. You'd be saying
Yes.
that had been there for
Yes, ma'am. I
24
got that.
hours or since 24 hours. Okay.
Yes.
All right.
Yes.
This is it. Okay. Right. All right. Yes, Dr. Zona, again, this one's for you. She was admitted in Royal Brisbane and Women's Hospital on this date because she collapsed at home.
She was admitted in Royal Brisbane and Women's Hospital on 24/7 because she had collapsed at home.
Right? Very right. Had collapsed. Something happened before, right? Had collapsed at home. You guys are following, and I'm very grateful for you for following, right? Okay, Dr. Narjana, this one's for you, and then we'll be moving forward. On rechecking, okay. I want to make it a little zoomer. Right. So on rechecking at 10:45 p.m., her condition has further deteriorated, and an ambulance was arranged for transfer to the hospital. Yes, Dr. Narjinder, can you hear me?
Sorry, ma'am. I was just speaking. The speaker was muted.
Okay, okay, yes, please.
Her condition had further deteriorated.
You're saying her condition
Had
had,
further.
right? Because when you
Yes.
say has and was, these are both in simple past tense, and the rule of the grammar here is that you have to use past perfect with your simple past tense. So you'd be saying her condition had further deteriorated and ambulance
Yes.
was. All right, this is great. Now what we're going to do is we're going to make subject and verb agreement with it. Now the thing is that what is the difference between subject and verb? Can anybody tell me what's the subject and what's the verb? I'm saying a pen was there. Which is a subject, which is a verb? Okay. Okay, I'm saying a pen were there. Is this correct sentence, Dr. Zona?
I'm not getting your point.
I'm saying that what is the difference between subject and verb? What is a subject? What is a verb?
Um,
Okay.
I cannot explain now.
All right, that's all right. Okay, so can you tell me which sentence out of this is correct? A pen was there. A pen were there.
Was there?
This is correct. Why? Because there is one pen. If I say
Yes.
pens were there, then this is correct. This is your subject, this is your word, right? So when you write your letters, you have to make sure that the subject and verb agree. The suture has been. Sutures have been, right? All of the medications are unavailable. One of the medication is unavailable. Are you guys following? Dr. Zona, Dr. Najinder, and the rest of you who haven't changed your name yet?
Yes. All right.
Following? Clear? So you have to make sure that your subjects agree with the verb, right? Okay, so let's make you do some sentences. This is for you, Dr. Zona. All these findings has been confirmed with white wing radiographs. Yes,
Which one are you asking me to tell you?
this one. All these findings has been confirmed with white wing radiographs.
All these findings have been.
Have been, right? Okay, all these findings have been confirmed with bite wing radiographs, right? Because why? There are too many radiographs going on, right? Okay,
Yes.
this one's for you, Dr. Narjinder. I am writing to refer this patient who I suspect is suffering from rheumatic fever and need urgent admission.
Who I am writing
Right?
to refer this patient who I suspect is suffering.
Yes, Dr. Narjinder.
For me, it's correct.
What?
I'm writing
Can
to
you say a little louder?
uh, once again. I am
Mhm.
writing to refer this patient who I suspect is suffering from rheumatic fever and needs urgent admission.
Right? Need.
Yes, ma'am, it's needs.
Needs. So this is how you'd be doing it. You'd be making sure that if there's a one patient, you'd be talking about needs, and if there are many patients, then you'll be talking as need, right? I believe that teeth is a plural, right? So 64 and 65 need to be extracted. You'd not be saying need to be extracted, right? So make sure that your verb and subject agree. All right. The next thing that we're moving to very swiftly is countable and uncountable nouns. Can anybody tell me what's the difference between a countable and uncountable noun? Yes, anybody. Just randomly, any of you. What is the difference between countable and uncountable noun? Dr. Noza has just joined in. Dr. Noza, can you hear me?
Yes, I can hear you, but I'm driving. So the difference.
Okay, I'll do this for you. Don't worry. I'll be sending it to you. Don't worry about it. Okay, so just start join from here. It's all right. Okay, so can you tell me what's the difference between countable and uncountable noun?
Countable you can count, uncountable you cannot. So uncountable they will not have s at the end, for example.
Okay. All right. That is a great answer. Yes, Dr. Najan. All right. That is great. That is great. All right, Dr. Najanda, what's the difference between countable and uncountable noun?
Yes, ma'am, that's correct. Countable nouns have s at the end, like
Okay. All
rice,
right.
look. Yes, ma'am.
Men is countable or uncountable?
Uncountable.
Why?
And
If I
it's a
say
plural.
7 men, is it countable or uncountable?
Yeah, it's a countable.
Right? So it's nothing to do with the S, but the fact that if you can actually count them or not, right? Okay. The fact that we are using countables and uncountable, it just depends on what article we'd use, right? How would we decide if a word is countable or uncountable? If you can use the countable A or N with them, right? We can use the with all the nouns, be it countable or uncountable. She received the advice, or the advice was regarding what? We discussed that. What we're trying to learn here is that countable nouns can have plurals and singulars. They can have articles A and N. Uncountable nouns cannot have a singular, and the articles A and N cannot be used for them. Are you guys following so far? Dr. Zona, Dr. Zona, Dr. Noza, Dr. Zona, Dr. Narjinder, the rest of you who are there. Do you guys follow? Any questions so far?
No. So uncountable will not have a and n, right? But what about the?
What about?
The. T-H-E.
Yes, you can use the with them. Right, we'd be moving forward and we'd explain why and how. All right, now I have to ask some questions and I want your responses. Who is this who just spoke? Was it Dr. Pavi? Okay, all right. Okay, so right, Dr. Pavi. So Dr. Pavi, thank you for being here. I would want you to change your name later on when you join later. For now, I have a question for you. The word advice.
Yes,
is it
ma'am.
countable or uncountable?
Uncountable.
Why? That's all right. You can give any reason that you have. You said it's uncountable, so why? I'm not going to judge here, right? I'm just trying to teach. Okay? Yeah.
We can only give a particular advice.
Mm-hmm.
We cannot give multiple amount of one sum. So we can only give one particular advice to a person. That's why.
So it's countable or uncountable?
So it becomes countable. Yeah, so it's countable.
Okay, all right, okay. Yes, Dr. Najinder, is advice countable or uncountable? Thank you, Dr. Pavi.
Yeah, thank you.
Seems to be countable, I guess. Yeah,
It's
countable.
All right. Yes, Dr. Zone and Dr. Noza, is advice countable or uncountable?
I think it's uncountable. We can say I can give you some advice, but we cannot say advices, right? I believe.
All right. Okay. Yes, Dr. Zona, is advice countable or uncountable?
I think it's uncountable.
Why?
Because you say like it's some, like I give a piece of advice, not like you can count the advice.
All right. So if I tell you, okay, this is good, be confident in your answers. All right. I'm not going to kill you, I swear. Okay. So the thing here is, thank you for replying, Dr. Zona. So the thing here is that, you know, when I say advice, and you come to me and you say that Dr. Hafsa, Dr. HWD, we need advice regarding OET, and then I start speaking and I can go on for an hour. I'll be telling you about, you know, writing, reading, speaking, and listening. Then you would just go to your friend and you'd say that Dr. HWD or Dr. Hafsa, she gave us advice regarding OET. Right? She gave us advice regarding OET. Now, I gave you so many things to talk about, but you just told her that she gave us advice, right? Or you can
Yes.
say she gave us a piece of advice. Now, I told you
Yes.
so many things, but you see the word a piece, the word is used with the piece, not a advice. I cannot say an advice. I can say a piece of advice, right? I can say some piece of advice, right? I'll give you some piece of advice. Now you can use articles with the first word. You cannot use articles with this word because advice is uncountable, right? One person giving you advice would be talking about millions of things, right? So advice is uncountable. With this noun, you cannot use a or n. You can use the. Clear, Dr.
Okay.
Zona? Is it clear? Dr. Noza, Dr. Narjinder, Dr. Pavi, is this clear? Dr. Qasim, are you here today? Okay, right. So this is how you'd be doing. Another word, pain. Is pain countable or uncountable? Pain. Dr. Noza, is pain countable or
I think
uncountable?
it's uncountable.
Why?
Uncountable.
Why?
Because he has severe pain. I never saw pain suffer. I don't know. I think it's uncountable.
No, be very confident in what you say and you can give a backup answer, right? That's what we're learning here, confidence, because we all know English and we have took our exams in English, so it's pretty clear that we can understand what English is. So be very confident in what you say, right? It's hardly going to be wrong, right? So you're saying that pain is uncountable, right? Dr. Narjinder, is pain countable or uncountable?
I guess it's countable. Like we say, he has pain in groin. It's a particular thing.
So you're
While on
saying,
the other side, we say multiple sites of pain.
yes, you're saying he has pain, saying he has pain in groin, right? You're saying
Yes.
he has pain in groin.
Yes.
Right? He has pain in groin. Okay, you're saying he has pain in groin. All right. So, is pain countable or uncountable according to this one?
It could be uncountable also because we are not specified that in what side the pain is there in groin. I can
Right.
comment on this.
Pain is semi-countable. I can say she has a pain in her head. You are a pain, right? I can say it. It is semi-countable. When you're going to write it in your letters, it is going to be countable. There are times when pain can be uncountable because it can involve a lot of the structures of your body, right? So it's semi-countable, but when you write your letters, it is countable. Do you guys understand? Another word is attention. Attention. Is attention countable or uncountable, Dr. Pavi? Attention, countable, uncountable?
Attention.
Hmm.
It's uncountable.
Why?
Once again, we cannot count the amount which is, it is not multiple. It is.
Right, you're very right. Why are you being underconfident? You're saying the right thing. Be confident in what you say. See, when I say I need your attention, you would be looking at me, you'd be watching, you'd be listening, you might be smelling, right? You might be touching your pen or something, you might be writing down. So attention is uncountable, it's not countable. Right? So we're gonna go through a list of words and we'll be seeing if you guys can understand it. Right, so these are some words. Is complaint countable or uncountable? Complaint, countable or uncountable? Dr. Zona?
It's countable
Why?
because you can have one or two complaints.
Okay, we cannot do one or two complaints. Okay, all right.
We can
Okay.
have the plural of it. That's why.
What if I say complaints? Then it makes it uncountable or countable?
Mm,
You're saying the right thing.
it is countable.
Is it countable?
It is countable, I think.
You think it's uncountable? Yes, Dr. Narjinder. Is complaint countable or uncountable?
That's kind
Yes, Dr.
complaint
Narjinder.
is, it's countable, I guess.
A complaint is countable, right? Now,
Yes,
again,
it's
this
countable.
is one such word which depends on, the context of the thing. However, in your letters, complaint is countable. Cavity is countable. Doctor is countable. Examination, episode, come. These words are all countable. Operation is countable. Another word here is surgery. Is surgery countable, uncountable? Doctor's nose up. Is surgery countable, uncountable? We need to move faster.
Countable. It's countable.
Countable, why?
Because he has several surgeries. We say surgery, right? So it's
Okay.
countable.
If I say the patient went through abdominal surgery during which he received a bowel resection, right, right colon resection, rectum resection, and anastomosis of the left colon. Is it still accountable or uncountable? She has a surgery today. Is it a correct sentence? She has a surgery today.
I think it will be the same way like you mentioned the other one, like a semi-countable. Like it depends on the text, I think.
Okay, before I answer this, let's ask you another question. Cancer. Is it countable or uncountable? Cancer.
It's uncountable.
Cancer is uncountable. Why?
Maybe not cancer. Several cancer. Maybe it's countable. I'm not sure.
Okay, you're saying it maybe is countable, right? You're
Yes.
saying maybe it's countable. All right. Okay. Yes, Dr. Narjinder, is cancer countable or uncountable?
It's countable, I guess. Cancer cells are
Why?
uncountable. Cancer
No,
is
cancer
countable,
can
I
be
guess.
uncountable too, right? See, cancer is unpredictable. That the very definition that we learned of cancer from Robbins, because I'm sure all of you everywhere must have read Robbins, or maybe you do know the basic definition of cancer. That is that an uncontrollable division of cell, right? That's like the basics of it, right? So cancer is uncountable. Surgery in itself is uncountable because when I set someone on the surgical table, I don't know what procedure that person might go through. I might be needing diathermy. I might be cutting his nerves. I might be, doing some resections of the colon, or maybe just putting in the anastomosis. So surgery, cancer, these words are uncountable. Another word is tissue. What I mean by this is that I cannot use a with surgery or cancer when I'm writing my letters. Do you guys follow? It's
Ma'am,
really
could you,
important that you understand that. I'll be giving examples
could
for
you
sure.
please repeat?
Repeat for?
Ma'am, could you please repeat the thing you explained a while back? What if singular and what if plural? What to use here?
No. What I said was that with countables, you can use a and n if it's the singular form of it. Uncountables do not have a singular or plural. I cannot say advices, right? Either it's a advice or advise, depending on what is happening in the context, right? However, one is noun, one is a verb, but I cannot say advises, I cannot say advices. People do use it in spoken English, but it's incorrect. I cannot say cancers, I cannot say surgeries unless the person is receiving two surgeries. But again, when we say the person is going through surgery, I would not say a surgery. That is incorrect. When you write your letters, be very specific, because just one can make your sentence incorrect. Cancer, surgery, tissue, these are uncountable nouns. Tissue again is uncountable. Why? Because it's dividing. Now there is another word, cell. Right? Is cell countable or uncountable? Dr.
It's
Pavi.
countable.
Yes, why?
We can count the amount of cells.
You can count the amount of cells, right? I could say a cell, right? One cell, two cells, three cells. Unless it becomes a tissue, then it becomes uncountable, right? So hopefully you guys are following. It's really, really important that you understand it. Review is countable, sensation is countable, social worker, test, visit, these are all countable. Now let's come to the uncountable words. These are your uncountable words. Advice, attention, behavior. Again, behavior is uncountable. Now you see, the thing is that if I say mental behavior, she has a deteriorating mental behavior. I said she has a deteriorating mental behavior. Now, behaviors could be of many types, but when I say behavior as overall, it is uncountable. When I say I need your physical attention or your visual attention or your emotional attention, now it's a type of attention. That's why it can be countable, but I'm using the with the first word attached with attention or behavior. I'm not using us or n with these uncountable words to get attached to them. Right? Clear? Everybody clear about that? Clear? Any questions, guys? It's really important to understand because we're moving forward. Damage is uncountable. Concentration again is uncountable. Information is uncountable. Right? I'm here to collect information, right? You're going through an investigation, you're saying, I'm here to collect information. Now, information is uncountable because you don't know what you might find. Again, pain in here is uncountable. When you use it in your letters, either it's countable or uncountable, but you would be using it as uncountable, not countable, right? I think I said the other way around, so I apologize for that. The patient experienced pain on palpation, not a pain, right? The patient experienced pain on palpation. Following, guys? All right, surgery, treatment, research, tissues, these things are uncountable. Now let's make you do some exercises. Right, Dr. Noza, this one's for you. Wound on her left knee has been stitched. How would you correct this sentence, Dr. Noza?
Wound on her left knee has been stitched. Sorry, I'm driving. So. I mean, has been. It's like it's a one thing, right? The wound already was stitched. Maybe was stitched.
Okay, I say wound on her left knee was stitched. Is it correct?
I think I will put wood on her left was stitched.
Okay, all right. Okay. Yes, Dr. Narjinder, how would you correct this? Wound on her left knee has been stitched or was stitched? I'm just saying was stitched as Dr. Noza said.
It's also right, and has been is also correct.
Okay, all right.
Correct, I guess.
Okay. Yes, Dr. Zona. How would you correct this? Wound on her left knee was stitched. Sorry?
No, it's incorrect. Has been. No, has been is incorrect because we have to mention.
These are correct. Both of these are correct, but there is still a mistake. Yes, Dr. Zona. How would you correct it? Wound on her left knee was stitched.
I think wound is countable. We can have multiple wounds. So a wound on left knee has been stitched.
Forget about the articles. The articles are very important. Thank you, Dr. Zona. Right, the articles are very important. A wound on her left knee has been
got
stitched.
it.
Right? All right, Dr. Zona.
I got it.
Right, that is great. I'm glad you got it. Right. So again, Dr. Noza, this is for you. I'm writing to refer Marvin, 7-year-old boy who was admitted to hospital on this date. Dr. Noza, how would you correct this one?
Very hard to look
Yes.
at the text and type. 7-year-old who was admitted. Who is admitted, right?
Okay, I say who is admitted.
And the 7-year-old, like after year, we have to put dash. Like
Okay.
7-year dash.
Mhm.
Who is admitted to hospital?
Now this is fine. I'm writing to refer Marvin, 7-year-old boy who is admitted to the hospital. Now it's fine. There is still one mistake.
Okay. Another mistake is to the hospital.
Okay, I'll say to the hospital. Still there is a mistake. All right. Yes, Dr. Narjinder. All right, Dr. Pavi.
Yes.
Pavi. Yes, sorry. Let's talk to Dr. Pavi. Yes, Dr. Pavi, how would you correct this? I'm writing to refer Marvin, 7-year-old boy who is or was admitted to the hospital. Yes, Dr. Pavi.
I'm writing to refer Marvin, a 7-year-old boy who.
Right, a 7-year-old boy. Right, Dr. Noza, Dr. Narjinder, Dr. Zona, all of you guys, a 7-year-old boy. Yes, you have to write dashes in between, right? But a 7-year-old boy. This is, this is an incorrect sentence, even though these are minor mistakes, but they have put this as incorrect. This is a file from OET official, right? Let's do one more and then we'll move forward. So this one's for you, Dr. Pavi. The patient has a cancer. How would you correct this?
The patient has cancer.
Right? No. All right, this is great. You guys are doing good. I would want you to go through this file and please go through it. Take your time, go through it, and then we would be, moving forward. Definitely, we're moving forward, and I would want you to go through this file because this is important. Now, let's come to the. When you're talking about something specific, you use the. Right? The patient has a pain in right knee. In the right knee, because now right knee is specific. Right? I'm saying, please listen to what I'm saying. I'm saying the patient has pain in knee. I'll say the patient has pain in the knee. If the patient has pain in the right knee, I'll be saying the right knee. The would come with right, not right the knee. You guys following? The is used for a specific. Now, one rule of OET letter writing is that if you're talking about a thing that you're mentioning for the first time, you would use a with it and not the, right? Or you would not use anything, right? So if I'm talking about a pain, right, or something, an information that has not been mentioned before, right, that has not been mentioned before. For example, here it says that initially she came to me for a blood test, then the blood test was negative. Right. So first of all, when I'm talking about this test for the first time, because it's non-specific, for example, I sent someone for an MRI, right? I'm saying an MRI. You guys follow and see what I'm trying to say is that when you send someone for an MRI, now it could be any MRI, but when they come back with an MRI, with the MRI, that's specific because that particular MRI would have a particular answer or a particular finding. So that's why it becomes the. You guys following me? So if I say an X-ray or a X-ray was ordered, right? So any X-ray could it be? It could be that she gets X-ray from UK. It could be that she gets an X-ray from Australia or from America or from the United Kingdom, right? An X-ray was ordered, but when she comes back, the particular X-ray becomes, instead of it becomes the, because now it's particular, it's specific. You guys following me? All right. Initially, she came for the blood test. No, she came for a blood test. The results of the blood test. No, a blood test. No, the blood test. Why? Because this particular blood test is negative, so it's the. You guys following? Dr. Narjinder, Dr. Zona, Dr. Pavi, Dr. Noza, Dr. Muhammad Qasim. You guys following me? The first time you talk about information, you use a and an. If you talk about the information later, you use the. Right, so let's do this. This one says the patient has the family history of diabetes. I'm writing this information for the first time. Yes, Dr. Zona.
If it is for the first time, then we'll use a family history.
Right, family history, because I'm writing it in the past in the social history paragraph, right? In addition, the pain in the right knee joint has appeared over the last 2 days. In addition, the pain in the right knee joint has
Will not
appeared
come.
over. Yes, sorry.
The will not come with pain as it is not countable.
That is very right. In addition, pain in the right knee joint has appeared over the last 2 days. Right?
I've
Very right.
also questioned like when we write in our letter on examination.
Mm-hmm.
So with examination is countable. So we
Mm-hmm.
have to write just on examination, or if it is for the first time, so do we have to use or like some, I'm confused about it.
Okay, you're very right. It's a very good question. So you're saying that when you're saying on examination, comma, should I use the here? So if I say on examination, right, and I'm doing it for the first time, or I'm just starting the examination. I'm saying on examination, she had a pain in the right knee. Or that's if you're talking about the first time, then you'd be saying no the. But if I say the examination revealed, then it's fine, right? Because you're talking about something that's specific. We're looking at here about the specificity. This is such a weird word. Whatever that is, we're looking for that instead of whether we use it for the first time or second time. So what I want you to focus in here is, even though we talk about the first time and the second time rule, I would want you to focus whether it's specific or not, right? Okay.
Okay.
So instead of saying on the examination, if you're saying for the first time again, you're very right. Both of these things are confusing, but see, if you talk about, let's clear it. If you talk about something specific, use the. If you talk about that particular thing which is specific for the first time, don't use the, even though it's countable. If you're doing
Okay.
examination for the first time and it's particular, it's specific, but for the first time, don't use the. If you're talking about an examination, you're doing it for the second time in the subsequent paragraphs, then use the. All right?
Okay, fine.
Clear? All right. Let's move to the next one. This one's for you, Dr. Noza. Thank you for seeing Mr. and Mrs. Conway, who have presented to me for fertility advice.
I don't see the screen. I'm sorry. Let me connect it. I'm home now. And I need to connect to my laptop. Sorry.
Okay, oh, that's all right. That's all right. Yes. This one's for you, Dr. Narjinder. How would you correct it? Thank you for seeing Mr. and Mrs. Conway, who have presented to me for fertility advice. Yes, Dr. Narjinder.
I don't know.
Can you hear me, Dr. Narjinder?
Yes, ma'am. Yes.
Yes. So how would you correct this one?
It's correct sentence, I guess.
There is nothing you would correct in here?
No, it's correct already.
Okay. Dr. Pavi, any incorrections here?
I'm not sure, but thank you for seeing Mr. and Mrs. Conway, who have presented to me for some fertility advice.
All right. Okay. Now let's see if it's correct. It doesn't need any correction. You can even say some, but doesn't need any correction. Dr. Narjinder was right. You have to be confident in what you say, right? I'll be here and I'll be mimicking your subconscious, something that helps you, forget the first thing that you had in your head. So I'll try to confuse you throughout our classes there. Right now, as you see this is correct. There is no need of correction in this one. It's already correct. Right? Okay, Dr. Pavi, this one. Thank you for seeing this patient, an 8-year-old girl who presented today with the broken left arm following the accident at his school playground It has been 40 minutes since accident.
Thank you for seeing this patient, an 8-year-old girl who presented today with a broken left arm following an accident at his school playground. It has been 40 minutes since the accident.
N, not the N. Not a N. Accident is with a vowel sound, right? So N. All right?
Yeah.
Which has been there since the accident. Now you're talking about accident the second time, so the. Now is it clear, Dr. Zona? Do you understand the mistakes now, like when you'd use in the, right? Yes, Dr. Noza, any questions, Dr. Zona, Dr. Noza, any questions at all? Because we're moving towards the end of it. Yes.
Ma'am, I'm still confused in and the.
Right. See.
Why isn't that correct? Why with the broken left arm? What's wrong in that?
See, the thing is that according to OET and the basic grammar rules, especially for OET, there are certain things that they want in certain way, right? This is correct for sure that the patient, like over here, you're saying, right? Let me just move towards that one, right? Think of seeing this patient who presented at my, no, where is it? Oh, wait a second. Right, over here. Thank you for seeing this patient, an 8-year-old girl who presented today with the broken left arm. Now, unless you are sure you examined the patient, right, and you have found the findings, how would you be so sure it's the broken left arm? And obvious, and you know you haven't examined that. So according to them, that when you mention a thing for the first time, use instead of the, because it's non-specific at that time. If you mention something for the first time in your letter, that is a rule that you would be using a and non-specificity instead of saying the.
Okay.
It's like a rule. Okay. I mean, you should go through the file. If still there are confusion, please do ask. We'll be making sure we solve that. Now let's move to the special things, right? Usually I take 3 days to do grammar, but because this is a crash course, so we're powering through and we're doing it in 1 day, right? Hopefully we'd be able to do this. Now, these are certain words that are used in spoken language and they cannot be used in a written language, right? So the patient asks for MRI. No, the patient requests for an MRI. The patient says he is sick. The patient states he's sick, right? Said is spoken, stated is formal, polite, and professional. She got her result. She received her result. I think she needs your help. I believe she needs your help. She likes juices like mango and orange, such as mango and orange. I hope you guys are following. I'm powering through, but it's really important. Get, got are something which is used in spoken, so cannot be used. Don't is a contraction. We don't use contractions in your letters. About, instead of saying about, use regarding. So is again not to be used. Very is to be used. Thanks is again a contraction. You don't use it. You say thank you. But now let's talk about a little bit about the connectors, right? So there are certain connectors that you would want to make sure that you steer clear of them no matter what. The first one is furthermore. You would not be using furthermore in your letters. OET hates it. Even though this is academic and if you were taking IELTS, you'd be using furthermore. But in OET, no furthermore, no hence, no moreover. Okay, there are other connectors that would be talking about as well, thus, but these connectors are not to be used in your letters. One thing here is but. Now, when you're writing your letter, you would obviously be using connectors when you're connecting one piece of information to another. One specific set of information to another. For example, when you're talking about signs and symptoms, and then you move to the labs, it's one set of information, you move to the labs, this is when you use a connector. You don't use connectors in between the specific sets of information, right? I cannot say, and I should not say, the patient presented with nausea, vomiting, in addition to diarrhea and constipation. I'll be saying along with, I can say comma, constipation and diarrhea. I should not use it because, you know, this would just prolong the thing. Why cannot simply state that he has these symptoms? But when I talk and I move from one thing to another, from one category of information to another, that's when I use connectors. Connectors could be therefore, however, in addition, also, along with, these are your connectors, right? So what I was saying is, right, all the connectors that you use, you would be using in the beginning of your sentence. Therefore, not in the middle, right? Not in the middle. I wouldn't recommend it. You can do this, but I wouldn't recommend it, right? So therefore, however, meanwhile, starting of the sentence. But is a connector that you can use, but you cannot use in the starting of the sentence. You can use it in the middle of the sentence, right? However, can be used in the beginning. However, can be used in the middle. But is a connector that they don't want you to use in the starting of the sentence. But she has diarrhea. I don't know why I'm obsessed with diarrhea, but she has diarrhea. You cannot say this, even though this is correct, but they don't like you to say it. What you would do is you would be using but in the middle of the sentence. Clear, guys? Is it clear? Any questions
Yes.
so far? No
No.
questions, Dr. Noza, Dr. Zona, Dr. Narjinder, Dr. Pavi, Dr.
Yes,
Qasim?
ma'am, I have one question.
Yes.
Ma'am, is it the right way to say like flu-like symptoms which become subsided with augmentin?
Sorry? Flu-like
Can we
symptoms?
say like which normally we say like which got subsided, but in OET we can't use got. So instead of that, could we use which become subsided with?
What if you said
Same
that
metformin.
you're very right. You're saying that we cannot use got. Can we use become? Because something here is that your got is exchanged by become, right? That's what you're saying. What if I say that she presented with flu-like symptoms which subsided with this? You don't even have to say become or got. You just say
Yeah,
it subsided with that, right? So
it's
use these
looking
sentences
somewhat
where
incomplete, I guess.
sorry.
I don't know. I guess it's looking somewhat incomplete, like which subsided with, or it's correct like that, which subsided
No,
with
if I say,
metformin.
see, listen, you're very right. You're very right. Now I'm saying that she presented with let's talk about diarrhea because I don't know, today it's a word of the day. So I'm saying she presented with diarrhea and she was prescribed with what is that drug? Flagyl, right? She was prescribed with Flagyl and her symptoms subsided. Her symptoms subsided with it. Is it complete now?
Yeah,
Her
but
symptoms
it's
subsided with it. Or her symptoms became less. Or her symptoms became subsided. Do you think this is correct? Became subsided? Now you see, subsided is such a word that is a verb in itself, right? So you don't need to use a
good.
verb. Okay, now what I'd recommend is because this is the list that you might be forgetting, I'd recommend you copy paste it or you just write it and use it and keep it in front of your desks when you're writing. Your OET criteria and this list should be in front of you every time you write your letter, along with a timed clock where you'd be using alarm of 35 minutes, as we explained earlier, that when you're writing your letters, you should be timing yourself as 35 minutes, right? So let's do one or two examples and then we'll be moving forward towards the abbreviations, I'm thinking, right? And after abbreviations, we'd be using common mistakes where we'd be talking about the titles and we'd do comma tomorrow, right? We'd do comma tomorrow with the letters. So we're almost done with the grammar, right? Even though I take 3 days, but I've taught you almost the important things of it in a day. Now, like within 2 hours, that is wondrous. That's wonderful, right? So, Dr. Narjinda, this one's for you, right? I would really appreciate your attention regarding further management of this patient. Right? So I would really, this one, I would really appreciate your attention regarding further management of this patient.
Should I do in this? It's correct, I guess.
It is
I would
correct, but
really.
really is a spoken language. You cannot use really, rather you'd say
Yes, yes.
greatly.
Highly
Greatly
appreciate.
or highly, right? Very right.
Yes.
Okay,
Okay.
Dr. Zona, this one's for you. About his dietary habits, he eats a large amount of oily and sweet food. Did I ask Dr. Zona or Dr. Noza? Okay, Dr. Zona, about his dietary habits, he eats a large amount of oily and sweet food.
I think it's correct.
Okay. All right. We just went through a list where we said about is not to be used, regarding is to be used. So you'd be saying regarding his dietary habits. About is not to
Okay.
be used according to the list. All right. Okay. All right, just go through the list, guys. It's really important, right? Let's just ask Dr. Um, Noza. Dr. Noza, she had lots of pain.
She had lots. We cannot say lots. She has a lot of pain.
Right, she has a lot of pain. That's very right. It's a very simple thing that I told you. So asked you from, so asked from you, so I'll just ask you this one as well. There was nothing significant in his social history.
Significant? Maybe. Oh, there was nothing important, maybe.
Okay, now you see here, nothing is not to be written. Rather, you'd be saying the social history was, there was no significant findings in his social history. Nothing is not to be said. These are some stupid rules of OET. I had them myself, but because we have to pass
Or
letter,
no
so
remarkable, I guess.
sorry.
And no remarkable findings, I guess.
Yes, no
That would be
remarkable
used, I
findings is good, right? Okay, yes, Dr. Pavi, this one's for you. This is very right. See, there are certain things that OET hates, and there are those things which are allowed in IELTS, and both of them are, English language tests. But you would not want them to upset you, even though you'd be like, no, this is right, I will write it. No, don't do that, because you want to pass the exam, you would be following their rules, and once you're done with them, do whatever you want, right? You can even write U with a U and not YOU. All right, but for the sake of the exam, please just improve your writings, write in a better way, follow the rules so that you could get a 350 and then you can change the rules when you go on the top. Right? Okay, Dr. Pavi, this one's for you. The mother got sick for a few days.
The mother got sick. The mother was sick for a few days.
Right? We cannot say got. You could say the mother became sick. Right? You could either say the mother became sick. Right? Okay, clear, guys. Now let's move to the next thing. Okay, please go through this file. Really, really important that you do. Now let's move to medical terminologies. Now, first, let's talk about things which are really important. All right. So BID. Now you see, I told you that you're writing your letter to who? Who are we writing the letter to?
To doctor or
Yes, to the doctor and
physiotherapist or whoever. Like the letter will tell us. Surgeon.
OET professionals.
yes, we're writing the letter to OET professional
Mm.
and to the doctor. These are the three questions that you have to keep in your head: who, what, and why when you write your letters. Right? So the OET examiners want you to write the abbreviations which are universal. Right? MRI, is it universal? You guys are from different parts of the world. I guess Dr. Pavi is from India, Dr. Narjinder is from India, Dr. Zona is from Pakistan, and Dr. Noza, you are from
India.
Americas?
I'm also from different country, but I live in US, yes.
All right. Well, so where are you from? That's okay. You can tell us. That's all right. We're not judging. Right?
Yeah,
So,
I'm from Russia.
oh, that is great. So the thing here is that MRI is universal, isn't it? You use it all around the world, right?
Yes.
ECG is something that they use in USA, but ECG is something that they use in the Asia, right? Like in India and Pakistan, even in Australia, they use ECG. So this is something exceptional that ECG and EKG can be used as abbreviations. CT scan is the same throughout the world. X-ray is same throughout the world. Now, my question to each of you is, Dr. Narjinder first, what do you call blood report in your country? Like
Blood
where you check
report.
the hemoglobin, etc.
We generally say CBC के sample पे तो
CBC, right? You say CBC,
CBC, right?
right? You say CBC, right? Okay. Yes, Dr. Noza, what do you call CBC? Like the blood profile or the blood report in America?
In America?
Yeah.
We call it blood work done. I mean,
Blood work, right? Blood work. Or you might be thinking that they call it FBE. No, full blood evaluation. Yeah. And what do they call it in Russia? I'm sorry if it's bothersome. I wouldn't pick that up,
No,
right?
no,
But I need to ask. Yeah, yeah.
Russian and everything will be laboratory labs.
Laboratory. Okay, that's okay. So, yes, Dr. Zona, what do we call blood report in Pakistan?
It's CBC.
CBC, blood CP, yeah, right? Or we can say FBC. So there are so many words for it. This is why, because it's not universal. Whenever you have these words, you'd open them up, right? But you would not be opening up the abbreviations which are universal, such as CT, MRI, X-ray, right? Different countries call different words, different abbreviations for different blood tests, right? Different laboratories, right? So there is one more thing, and that is I totally forgot which was my train of thought. DKA. I guess we talked about it earlier as well. DKA is diabetic ketoacidosis. And if there is an endocrinologist and we're writing the letter to endocrinologist, definitely he'd know what DKA is. But because we're also writing to the OET examiner and he doesn't know what DKA is, even though it's a universal thing, maybe it is, maybe it isn't, we have to first write diabetic ketoacidosis. And when we move forward, that's when we'd be saying DKA. Right, so first you write the whole thing, diabetic ketoacidosis, put it in parentheses as DKA, and later on you can say he has DKA. Even though we're writing to an endocrinologist, what I'm trying to say is that you have to think of three things when you write your letters. Who am I writing to? OET examiner, and which is a doctor. Why am I writing for? What am I writing for? Your abbreviations, only the ones which are universal can be used. And Latin abbreviations are not to be used. If you're using medical abbreviations, make sure you open the abbreviation first, you write the full form, then use the abbreviation. Right, guys? Right? Okay. Likewise, SOB, shortness of breath. Right? Not a lot of people call shortness of breath as shortness of breath throughout the world. So this is something that you take care of. Right? Okay. Everybody understand? Dr. Noza, Dr. Zona, Dr. Narjinder, Dr. Pavi, Dr. Muhammad Qasim, Dr. Usman. I don't know if Dr. Usman is here today. Yes. Understood?
Yes, I have a question.
Yes,
Like,
please do.
I was told that any numbers below 10, we have to actually write. Instead of 5, we have to put FIVE, right? For example. So if the mammogram will show the lesion 4/2, so we still have to put the whole letters instead of
I
numbers?
No, I don't know where you've heard it. It could be true, but as far as I've been teaching this for like 12 months now, so like
Mm-hmm.
an year, I'm still, a very small person. But the thing is that you don't have to write numbers into in words. I'd say write them in numbers or in words, depending on whatever works for you. Right? If you feel like TWO2 should be written, you can do that. If you want to write it 2, that's okay. They are not strict about that. All right?
Oh, got it. And what
Okay.
about millimeters and kilograms? We can
We're
put kg, right?
we're coming to that. We're coming to that. First, let's go through this, right? I'll make sure that I answer your questions, right? We'd be coming to that. Okay. Now, BID, right? BID, SID, TID, QID. Can anybody tell me what that is? Yes,
That's
Dr. Pavi. What's QID or
It's
BID?
4 times a day is QID, and BID is 2 times a day, and TID is thrice a day.
Right? So SID, BID, TID, QID, you use them for your drugs prescriptions, right? You would not write like that. You'd be saying 1 times a day, 2 times a day, 3 times a day, 4 times a day. Another word is PRN. Can anybody tell me what's PRN? Dr. Noza, Dr. Narjinder, Dr. Zona,
per,
anybody?
per needed?
As needed, right? As needed. So you would not write PRN, you'd write as needed,
Yes,
right?
miss.
And right? Following? Right? You guys following? Okay, any questions? Right. Then there is main nocte. This means morning, this means evening. If it said so, you'd be saying that in the morning, in the evening, right over here, right? ABDO, abdomen, AC, before meals, ADL, activities of daily living, and would not be written like that because this is also a fancy way of saying it. You'd be saying AND. BID, BP. See, BP and heart rate, right? You can use the words as it is because there are certain teachers who exempt you, but if you can write blood pressure, that's far better. Right? CUS complains of, you would open it up. Capsule cannot be written like that. You cannot say SYP. You would be saying the whole syrup. You would not be saying TAB, tablet. You'd be saying TABLET, tablet. Right? Clear, guys? You guys following? Go through this list. Really important. FBC again would be opened up. ECG not to be. DOB not to be. You should not open up. But IV, IM, SC, you should open these up. History is H. L is like this. Laboratory would be said laboratory, not just lab. You guys following? Okay.
Ma'am,
Energy. Yes.
is this
Yes,
table
doctor.
to be used or to avoid?
Sorry, is that Dr. Usman?
I'm not in there.
Yes, Dr. Narjender.
Is this table to be used or avoid?
This is to be used. This is to be used. You would not be using these abbreviations. These are not allowed. Okay.
In the starting of the letter, we used to write like DOP, date of birth of the patient.
DOB. This is what I'm saying. The exclusions are DOB, ECG, FPC, the ones that we talked about, because those are the ones that can be used. But you know, for medication, main, nocte, minute, right, tablet, laboratories, you'd be writing the whole words of them, right? You cannot say MIN. You would be saying MIN, QTE, minute. Right? Right, Dr. Najandar?
Fine.
Okay, tablet. Now, one more is over here. Question mark rheumatic fever. What does this mean, Dr. Noza?
Possible rheumatic fever. Possibility of rheumatic fever.
Probable rheumatic fever. What is this? H, 6 over H. What does that mean?
6 hours, 6 hours.
$6. Now, what is this? 312. Anybody knows what is 312? Okay, let's do this. Let's do this one. All right, over here. Okay, so let me just find a clean space. So I'm saying 5, 7. Then I'm saying 5, 12. Right? Then I'm saying 5, 24. Then I'm saying 5, 52. What does this mean? Yes, Dr. Narjinder. 5, 7. What is 5, 7? I'm saying pain 5, 7.
Oh. Is it the severity?
Severity, all right. Yes, Dr. Zona, what is 5, 7? Pain 5, 7 or pain 5, 12, 5, 24, 5, 52?
Can I answer?
Yes, yes. But first,
5
Dr.
days.
5 days out of 7?
Yes.
Okay.
And
Yes, Dr.
5.
Narjinder. Yes, Dr.
Actually, I was answering. My speaker was muted.
Okay. Yes. What is
5 by
552?
7 is 552 is 5 weeks from 52 weeks, I guess.
You're very
5
right.
weeks or 52 weeks.
You're very right. So see over here, 5 out of 7 means 5 days out of the 7 weeks, 7 days of a week. 524 means 5 hours of the 24 hours. 512 means 5 months of the 12 months. 552 means 5 weeks out of the 52 weeks, right? So this is what you'd be doing. All right, this is how you'd be writing this down. Okay, everybody clear about these abbreviations? This is how you'd use them. Okay. All right, now let's move to another one. You were asking about the acronyms of CM, KG, or G, right? This is what you can use, and these are acceptable. All right, Dr. Noza, these are acceptable. All right, let's do one or two examples, and we'll end for today. And tomorrow we'll be doing the titles and comma, and along with that, you know, certain other words. We're trying to divide that, and we'll be doing referral letters tomorrow. Okay, so this one's for you, Dr. Noza. This one's for you. Treat Claudia with prednisone 5 mg 1T SID for 7 days.
Treat Claudia with prednisolone 5 mg. So we need to put space first of all after prednisolone. Space and 5 mg together. 1 teaspoon once a day for 7 days, right?
So what is this T?
T, it's a teaspoon.
Prednisone 5 mg 1 teaspoon.
One tablet. One tablet.
One tablet, right? Even though they haven't said TAB, but it's tablet, right? Yeah. This is correct. You look over here. This is correct. All right. Thank you, Dr. Noza. Right. Dr. Pavi, this one's for you. I'm writing to refer Mrs. Wilson, a 45-year-old woman who is suffering from signs and symptoms suggestive of advanced English. Wow, that's awesome. But Dr. Bobby, how would you correct this?
So it's supposed to be the YR of your should be YEAR.
Right? Right, that's correct. That's correct. You're very right. Okay. Dr. Narjinder, this one. Her mother died of MI.
Her mother died. It's myocardial infarction. We have
Right?
to
You'd write
spread
the
that
whole
word.
thing. Right. Okay. Yes, Dr. Zona, I don't think we've done with you, right? So here, her medication include SID metformin, 500 milligram main and nocte, glycosamine main, and candistrone nocte.
Her medications include metformin 500 milligram once daily in the morning and evening, glycosamine 5 milligrams in morning, and candistatin 10 milligram in evening.
That's very right. Okay, you guys are doing good. Let's just do a little bit of capitalization and then we will end this, and tomorrow we'll be doing titles. Do you guys have the strength to go through, because it's been 2 hours? Can you still continue, or should we end this today? Whatever works for you.
I can continue.
Yes, you just joined in, Dr. Nose. I'll be asking them as well, right? So yes, Dr. Narjinder.
Ma'am, I have ICU in morning, 7
Okay,
a.m.
so we'll do this tomorrow. We'll be starting from this one. Please go through this file. It is really impossible to do grammar in a day. I take around 3 to 4 days for this, but because this is fresh food, so we're trying to do this. So it's ended for today. Do you guys have any questions? Dr. Noza, Dr. Narjinder, Dr. Prati, any questions at all?
No. Ma'am, everything fine.
Yes, Dr. Zona.
No, it's clear.
Everybody clear about it? All right. So please go through this file, and I'll be seeing you guys tomorrow. And inshallah, we'll complete this. Okay. Thank you so much, everybody.
Thank you for recording. Bye-bye.
Thank you. No, we're going to do this, right? So I'll do this for you too. So thank you so much. Have a great